Hey, good evening, everyone. Thank you for joining us. This is the Grenada Food and Nutrition Council's webinar on the topic Cooking with Danger, the health impact of reused oils in Grenadian kitchens. We thank you very much for joining us this evening. My name is Rosalind Douglas. I'm the Communications Officer, and I'll be serving as the Zoom master and co-host of this evening's session. I would like to take this opportunity to acknowledge the presence of our Chief Executive Officer, Mrs. Lydia Brown, who is here to join us for the session. And a little bit later on, she would give some remarks. This will be a very succinct presentation. We have Grenadian specialists here that are going to give us some evidence-based information about the dangers of cooking with reused oils. We have Miss Larissa Mark, and we have Dr. Ariel Frederick. Larissa Mark is a national epidemiologist for the Ministry of Health in Grenada. She leads the Epidemiology and Health Information Unit, overseeing national disease surveillance, outbreak response, and digital health initiatives, including DH1S2 implementation, ICD-11 mortality coding, and the launch of Grenada's second population-based cancer registry. Ms. Mark is a Fulbright scholar. She holds a Master of Public Health degrees in epidemiology from the University of Nebraska Medical Center and in environmental and occupational health from St. George's University. Her work focuses on strengthening surveillance and data systems for non-communicable diseases, advancing sustainable cancer and NCD registries, and collaborating with regional and international partners such as PAHO, CARFA, and the World Bank to inform policy and guide prevention and control strategies across Grenada and the Caribbean.
Thank you, Ms. Douglas. Good evening, everyone. My name is Larissa, and I serve as a national epidemiologist for Grenada at the Ministry of Health. Non-communicable diseases, often called chronic diseases, are the leading cause of death and disability in Grenada. Today, I'll share a snapshot of the past 5 years, what the data shows, the challenges we face, and most importantly, some steps we can take together to change this trend. So this evening, I want to share with you a clear picture of the chronic disease burden in Grenada, Carriacou, and PT Martinique, and why it matters for us all. By the end of this session, you should be able to understand the current burden and trends of non-communicable diseases in our country. You'll also see how conditions like diabetes and hypertension are not just problems on their own, but precursors to other serious illnesses such as heart disease, kidney failure, and stroke. We'll look into the main risk factors driving these diseases and think about where prevention can really make a difference. And finally, I'll highlight some of the key programs and interventions already on the way by the Ministry of Health and how each of us, whether as health workers, leaders, community members, has a role to play in supporting better health outcomes. So the overview for this evening's presentation, we'll go through why NCDs matter, we'll go through some mortality and hospital trends, prevalence in the community, as well as risk factors, some key risk behaviors, and the current management programs. So by definition, a non-communicable disease is a long-term, non-infectious condition that cannot be directly transmitted from person to person. Non-communicable diseases, or NCDs, as they're often called, they usually last a long time and develop from a mix of genetic, physiological, environmental, and behavioral factors. The main types include cardiovascular diseases such as heart attacks and stroke, cancer, chronic respiratory diseases like asthma and COPD, and diabetes. Globally, NCDs has the heaviest impact on low and middle income countries. In fact, almost 3/4 of all NCD deaths, about 32 million people, occur in these regions. NCDs are responsible for more than 85% of all deaths in Grenada, and there is a 23% probability of premature mortality from NCDs, far more than infections or accidents. They're also the leading cause of hospital visits, disabilities, and financial strain on families. From this chart on mortality trends for the period 2019 to 2023, neoplasms or cancers remain the leading cause of death, showing a consistent high burden over the 5 years. Deaths from ischemic heart disease have steadily increased, highlighting growing cardiovascular challenges. Diabetes, death due to diabetes have remained relatively stable, peaking at slightly in 2022. Hypertensive diseases gradually rising, reflecting the importance of blood pressure management. Respiratory disease deaths decreased in 2020, likely due to pandemic measures, with a partial rebound by 2023. The one noticeable change to note is the number one cause of death in 2021 was due to COVID-19, but that declined subsequently after. External causes and stroke-related deaths fluctuate, emphasizing the need for injury prevention and stroke care. So overall, non-communicable diseases dominate mortality, underscoring the importance of prevention and early intervention. Considering that cancer has been the number one cause of death for the past 5 years, with the exception of 2021, here we see a graph highlighting the types of cancers and the number of cases over the years, showing the trends. Male-specific cancers, driven almost entirely by prostate cancer, account for about 23% of all deaths, as you can see in this pink line here, making it the single largest contributor overall. Female-specific cancers, led by breast, make up for 21%. Digestive system cancers, including colon, pancreas, and stomach, contribute nearly 22%. Respiratory and head and neck cancers, such as lung and oral cancers, represent about 15%. Hematologic cancers, leukemia, myeloma, and lymphomas account for about 7%. The remaining cancers, which include kidney, bladder, brain, endocrine, skin, and unspecified sites together, form about 13%. Even when grouped into these larger categories, prostate cancer on its own still surpasses every other single cancer type in impact. This pie chart just again illustrates that prostate cancer is the number one cause of death based on the type of cancer in Grenada. And so it is important that we focus some more on men's health and screening programs for early intervention and detection. Let's zero in on diabetes and hypertension. As per the Grenada 2022 Population and Housing Census, diabetes shows a significant increase with age, affecting 6.3% of females and 3.7% of males. Hypertension emerges as the most widespread condition in older age groups. So this chart here would show the age and the prevalence of diabetes. So as you can see, as the age increases, so does the likelihood of diabetes and hypertension, noting that females are more likely to have the condition. Again, here we can see that prevalence increases steadily with age for both conditions. Hypertension is consistently higher than diabetes across all groups. Women show higher rates than men, particularly in the 45 to 64 and 65 plus age groups. This pattern highlights that the double burden of NCDs, especially among older women. These findings point out the need for targeted prevention and management strategies. This table shows trends in diabetes mortality from 2015 to 2023. First, overall deaths have more than doubled in less than a decade, from 43 in 2015 to 111 in 2023, peaking at 133 in 2022. Secondly, most deaths occur in the 65 and older age group, which reflects the strong link between AIDS and diabetic-related complications. Third, women consistently show higher mortality rates than men, especially in the years 2018 to 2022. Finally, white deaths among younger adults remain relatively low. The fact that we still see cases in the 25 to 44 age group is concerning. This slide looks at hypertension mortality trends from 2015 to 2023. We can see that deaths have more than doubled from 16 in 2015 to 37 in 2023. The 65 and older group consistently carries the highest burden, making up the majority of deaths each year. Deaths in the 45 to 64 age group have become more noticeable since 2019, while cases in the 25 to 44 age group remain rare. Gender patterns show an important shift. In recent years, women have consistently recorded more hypertension-related deaths compared to men, particularly among older women. The key takeaway is that hypertension mortality is rising, especially among women and older adults. Now, this chart shows hospital discharge diagnosis in Grenada between 2019 and 2023. Across the 5-year period, we recorded just under 10,000 NCD-related discharges. The majority were due to hypertension and diabetes, which together account for about 2/3 of all cases. Both conditions peaked through 2020 and 2021 before gradually declining. We also see that stroke remains a major contributor with nearly 1,000 discharges in this period. Cancer diagnoses have stayed significant with a noticeable spike in 2020. Chronic kidney disease follows a similar trend to diabetes and hypertension, while chronic respiratory disease and heart disease appear far less frequently. The overall pattern shows a rise in 2020 and 2021, followed by a decline through 2022 and 2023, which may reflect changes in healthcare access, reporting, and patient care. Why should we be concerned about diabetes and hypertension? They are not just conditions on their own. They act as precursors, setting off a chain of health problems if they're not managed properly. For example, hypertension or high blood pressure is one of the biggest risk factors for stroke, heart disease, and kidney failure. It silently damages blood vessels and organs over time, often without symptoms until the damage is advanced. On the other hand, diabetes raises blood sugar levels, which over the years harms blood vessels and nerves. That's why diabetes is linked to kidney failure, blindness, amputations, and also heart disease. What's important to see is how these conditions overlap. Someone with hypertension can have diabetes, and together they multiply the risks, leading to more severe complications and higher healthcare costs. So instead of viewing these separate illnesses, it helps to see them as part of a chain that we can prevent or manage the first domino, hypertension and diabetes. We can stop the others from falling. Now let's talk about the main risk factors that drive non-communicable diseases in Grenada. First, physical inactivity. Many of us are moving less, whether it's because of work, lifestyle, or access to safe spaces for exercise. A lack of regular physical activity increases the risk of diabetes, hypertension, heart disease. Second, tobacco use. Even though Grenada has lower smoking rates compared to some countries, tobacco still remains a major risk factor, not just for lung cancer, but for cardiovascular disease and stroke. Excessive alcohol use. Alcohol is often overlooked, but heavy drinking contributes to liver disease, cancers, high blood pressure, and accidents. It's a hidden driver of many health problems. Diets is a major driver for NCDs, and one important example is the use of reused cooking oils. This practice produces harmful compounds linked to heart disease and cancer. Our next speaker will go deeper into this issue and its impact on health. And finally, obesity and overweight. This is one of Grenada's fastest rising concerns. Extra body weight increases the risk of almost every major chronic disease, from diabetes to heart disease to certain cancers. Together, these four risk factors fuel the NCD burden. The good news is that they are modifiable, meaning that with the right choices, policies, and community support, they can be reduced and prevented. Now that we've gone through the NCD burden in terms of numbers, let me walk you through some of the key initiatives and policies currently in place to address non-communicable diseases in Grenada. We launched the Hearts Initiative in February 2025. Its goal is to strengthen primary healthcare by integrating proven strategies for preventing and managing cardiovascular diseases, especially hypertension. The program promotes healthy lifestyle, counseling, standardized treatment protocols, access to essential medicine and technology, and team-based care with strong monitoring systems. In Grenada, as in other countries of the Americas, the initiative is led by the Ministry of Health with PAHO's, Pan American Health Organization's technical support. The aim is to improve hypertension control, strengthen cardiovascular risk management, and ultimately make primary care more effective in reducing NCD-related deaths and disabilities. At the regional and national level, we also engage with the National Chronic Non-Communicable Disease Commission in Grenada, or the NCNCDC, the Caribbean network of national NCD commissions, which allows us to share best practices and align efforts across the region. On the prevention side, Grenada has drafted a national childhood obesity policy, as well as the school nutrition policy in collaboration with the Grenada Food and Nutrition Council. These aim to create healthier environments for children by reducing unhealthy food options and encouraging better dietary habits. We've also been building stronger partnerships with NCD-related NGOs, recognizing that civil society has an important role in awareness, advocacy, and community action. In terms of services, routine screenings are available at all primary care facilities. That would be the medical stations and the health centers. This includes blood pressure, blood sugar, and other key checks. In addition, pap smears are available at an affordable cost of only 20 EC dollars across all primary care facilities, while prostate cancer screenings can be accessed through the district medical officer. We are also making progress in cancer prevention and control with support from the Windward Islands Research and Education Foundation WINDRIF. Grenada contributes to the Caribbean Cancer Portal, which strengthens research and data sharing across the region. At the national level, we are in the process of developing a cancer prevention and control policy, and we have established a population-based cancer registry to track cases for more effective and to guide interventions. Finally, we are in the planning stages of a cervical cancer elimination campaign, which will be a major step forward in women's health. Together, these policies, services, and partnerships show that while NCDs are our biggest health challenge, we are making real strides both in prevention and in care. As I wrap up, there are three things I want you to take away from this session. First, chronic diseases like hypertension, diabetes, cancer, and kidney disease are the leading causes of illness and death in Grenada. They don't develop overnight, and in many cases, they can be prevented or delayed. Secondly, conditions such as diabetes and hypertension act as gateway to other serious illnesses, including heart disease, kidney failure, stroke, and even amputations. Tackling them early is critical. And thirdly, prevention and management require all of us. Utilize the primary healthcare services available to you through your medical stations and health centers, especially for early detection and prevention. The Ministry of Health has programs in place, but lasting change comes when communities, health workers, leaders, and individuals each play their part, whether that's adopting healthier lifestyles, supporting awareness campaigns, or helping others make informed choices. Together, we can change the trajectory of NCDs in Grenada and protect the health of our people for generations to come. Thank you for listening. At this time, if there are any questions or comments, I'm open to those. I've also placed my email address in the event that anyone wants any additional information. Please feel free to reach out. Thank you.
Thank you very much, Ms. Mark, for a very detailed presentation about the work that you're doing and the Ministry of Health. At this time, we'll be able to take questions from the attendees. We currently have 79 people in the room, record number. Are there any questions?
Ms. Douglas?
Yes.
Okay, can I ask a quick brief question to Ms. Mark?
Yes,
Thank you so
absolutely.
much. That was a great presentation and very, very informative as well. So in relation to the prevalence of disease, I noticed that Ms. Mark has disaggregated data by gender, and so I just wanted to find out in terms of the ministry's plan or vision for disaggregation by occupation. Is that coming anytime soon? Is that in the pipeline? Because that will also be useful, valuable information in our fight to prevent chronic non-communicable diseases.
Thank you for your question, Dr. Telesford. As it relates to mortality, unfortunately, a lot of the medical certificates of death comes in with the occupation not being filled in. So we are currently in the process of training the physicians to record. Even if the person is retired, you can probably state the last job that they had. And we're also trying to set a standard as it relates to patients who are the outpatients as well as those in the community, utilizing the community facilities to at least ask the patient what is their occupation. And so we can, it will not happen overnight, but I think within the next couple of years, we should be able to have a good data set to do some proper analysis in terms of occupational health and the link between that and NCDs.
Are there any other questions? Let me just check the chat. Perhaps that question and the details would come out in Dr. Frederick's presentation, but in the chat, the person was hoping to hear some mention of a wide increase of the consumption of barbecue meat. Yeah. So that could be covered unless, Ms. Mark, you have a comment to make on that, or defer to Dr. Frederick.
I will defer to Dr. Frederick. I'm sure her presentation will cover that.
Okay.
Fried foods are tasty, but did you know that repeatedly heating cooking oil can be dangerous? When oil is heated again and again without being changed, harmful chemicals called polycyclic aromatic hydrocarbons, PAH, build up. These compounds can cause serious health problems, including lung, breast, and prostate cancers. Simply adding fresh oil to old oil doesn't fix the problem, it increases the risks. To protect your health, always use fresh cooking oil and avoid eating large amounts of fried food cooked in old oil or reused oil. A message from the Grenada Food and Nutrition Council. Eat local, strengthen food and nutrition security in Grenada.
So we'd like to thank you again, Ms. Mark, for your presentation. For those of you who joined when we started, this session has been organized by the Grenada Food and Nutrition Council, and the mission of the GFNC is to promote the health and well-being of the Grenadian population, encouraging them to make informed food choices and practice healthy lifestyles. Dr. Ariel Frederick is an internal medicine resident at Sarasota Medical Hospital with a passion for medical education, research, and community health. She completed her Doctor of Medicine at St. George's University in 2024, where she also earned a Bachelor of Science in Biology, summa cum laude. And she is currently pursuing a Master of Public Health. During her time at SGU, Ariel served as a teaching fellow, facilitating small group learning and teaching clinical skills. And she received a distinction in research for her scholarly contributions. She has co-authored peer-reviewed research on cardiovascular conditions. In addition, she is an active member of the American Psychiatric Association and the American College of Physicians. Beyond her clinical and academic work, Ariel volunteers as a crisis counselor with Crisis Text Line, supporting individuals in moments of mental health crises. Dr. Frederick, it's a pleasure to have you. Please begin your presentation.
Thank you. Very welcome, Ms. Douglas. So my name is Ariel Frederick. I'm currently a first-year resident at Sarasota Memorial Hospital, and today I'll just be going over the toxic effects of reusing and reheating vegetable oil. So on the list of things that we're going to cover today is defining what is vegetable oil and listing some common examples, explaining the chemical changes that occur when the oil is reheated, identifying harmful compounds formed during reuse, exploring the health impacts of consuming reused oil, focusing on carcinogenic and cardiovascular diseases, share some key results from a survey that I conducted on the reuse and reheating of vegetable oil in households or food establishments in Grenada, analyze some of the trends and behaviors observed from the survey, and then suggest safer alternatives and best practices, discussing methods that can be used to clean vegetable oil. So the practice of reheating and reusing vegetable oils is widespread, especially in domestic kitchens, street food settings, and commercial food industries across the globe. While it's economically appealing and seemingly harmless, this common culinary habit raises significant public health concerns. Vegetable oil is any fatty oil derived from vegetables, nuts, seeds, fruits, or cereal grains. Some of the common examples would include canola oil, soybean oil, corn oil, sunflower oil, and coconut oil. When the vegetable oils, especially those which are rich in the polyunsaturated fats, are exposed to high temperatures repeatedly, they can undergo chemical transformation. This results in the formation of toxic compounds, some of which was previously mentioned, including aldehydes, acrylamides, and polycyclic aromatic hydrocarbons, PAH. There is emerging scientific evidence which link these degraded products to various adverse health outcomes, including an increased risk of cardiovascular disease and certain cancers. Earlier, I think a question was asked about the use of barbecued meats. I can't speak for the increased consumption of barbecued meats, but similar to reheating and reusing vegetable oils, when you do grill or char these meats, you also create PAHs along with heterocyclic amines, both of which are carcinogenic. In 2019, nearly half of all healthy life years lost in Grenada were attributed to three leading causes. And like Ms. Mark already mentioned, those include cardiovascular diseases, diabetes, and cancer. As society continues to rely heavily on fried foods and fast cooking methods, understanding the biochemical changes in reheated oils and their physiological impacts becomes crucial for informing public health guidelines and promoting safer cooking practices. So when the vegetable oil is reheated, we all see that it changes its color. Sorry. And not only does it darken in color, but also this change indicates some potentially harmful degradation products. The color change is a result of three different processes, the first one being oxidation. So repeated exposure to heat and oxygen is what actually forms the aldehydes, ketones, and peroxides, which cause the oil to have the dark color. The other process that was observed is polymerization of the fatty acids, and you can think of this as the oil particles clumping up together. This is what increases its viscosity, making it really thick and dark colored. The last process is carbonization of particles left in the oil. So we know that we use the oil and sometimes you don't get out all of the particles, but it's harmful because these particles continue to carbonize in there. They continue to degrade and add harmful compounds to the oil that is sometimes reused. Darker oil often contains more polar compounds, which are associated with cytotoxic, mutagenic, and carcinogenic effects, meaning that it's harmful to your cells, it can cause your DNA to mutate, and can overall lead to cancers. So here I just have a picture to sort of demonstrate or illustrate when the vegetable oils, which are rich in polyunsaturated fats, such as sunflower oil, soybean, and corn oils, are subjected to high temperatures multiple times, they undergo oxidation and degradation. The breakdown of the fatty acids is what forms the toxic compounds, and even though we can't see it, the aldehydes, ketones, and free radicals are especially dangerous to human health. Free radicals are normally produced when we have inflammation or increased stress, but having too much free radicals can attack our cells, can attack the proteins and the DNAs that our cells need for all of their cytologic processes. Repeated heating also results in the formation of trans fatty acids, which alone is associated with several health risks, the biggest one of them being cardiovascular diseases. So now we'll talk about the impact on cells and tissues. Long-term consumption of the reused oil has been linked to cellular damage and tissue inflammation. The degradation of oil during reheating can cause oxidative stress, leading to DNA damage and increasing the risk of mutations, particularly mutations in the BRCA1 gene has been seen. This is linked to cancer development. Studies also show that if you consistently consume the reused oil, it can lead to an accumulation of harmful substances, and although the effect is not immediate, long term you have cell death and tissue damage. The other thing proven by the multiple studies was that it can lead to genotoxic effects and heighten the risk of cancer. Research in the clinical reviews in food science and nutrition found that such practices promote oxidative degradation, forming the harmful compounds that we already talked about. These damage DNA, and like I said, are associated with BRCA1 gene mutations. Not only is this gene mutation responsible for breast cancer, that it's commonly known for, but it can also lead to ovarian cancer. It has been lead to pancreatic cancer and prostate cancers as well. Findings in the Journal of Agricultural and Food Chemistry further confirmed that reusing vegetable oil exacerbates this particular mutation and increases your risk of breast cancer. In 2016 alone, breast and prostate cancer mortality rates in the US were 15.4 and 11.5 per 100,000 people, respectively. Whereas compared to Caribbean nations like Grenada, we had a markedly higher rate It was 43.5 for breast cancer in women and 90.3 for prostate cancer in men. And I believe Ms. Mark's presentation really highlighted how serious of a problem prostate cancer is in Grenada. With insufficient screening, I think it's important that we do as much as we can to prevent the occurrence of these diseases. I was also very happy that Ms. Mark mentioned the cancer registry and increased screening. It's definitely a step in the right direction. Repeated heating of oil can form other carcinogenic compounds. These compounds increase the risk of these diseases by promoting mutations in DNA damage. Particularly acrolein, which is an aldehyde, can also irritate the respiratory system and contribute to chronic lung diseases. Acrylamides or other probable human carcinogens form when starchy foods such as potatoes, so making fries, are cooked at high temperatures by methods such as frying. A lot of the evidence is suggesting that consumption of reused oil intensifies genetic mutation, which may lead to tumor development. The oxidative damage to cells in the body can initiate cancerous growths in various tissues. Not only can it initiate cancerous growth, but it can also exacerbate it and cause it to happen faster. So there's something called the two-hit hypothesis, where it's believed for somebody to develop cancer, they have to have two mutations because we all have two alleles of the same gene. So let's say a person were to have one gene mutation and they were to repeatedly consume reused or reheated oil, then they're at risk of developing a second mutation, which would push them in the direction of developing a tumor. There was also a study that was done in mice, which suggested that along with increasing the risk of cancer, it also increased the risk of metastasis. It showed that mice who consumed the thermally abused frying oil exhibited significantly more aggressive metastatic growth in the lungs compared to those consuming fresh soybean oil. The metastatic tumors showed increased cell proliferation markers and altered gene expression associated with oxidative stress and lipid metabolism. This simply means that if somebody already has a primary tumor, let it be ovarian, breast cancer, and they were to repeatedly consume or reuse vegetable oil, then they're at risk of that cancer spreading and ending up somewhere else. There was a critical review published in the Critical Reviews in Food Science and Nutrition, which highlighted that the consumption and inhalation of the fumes from repeatedly heated cooking oils could pose serious health hazards. The review noted that reused cooking oil and its fumes have been associated with an increased incidence of genotoxic, mutagenic, and tumorigenic and various cancers, including lung, colorectal, breast, and prostate cancers. So this picture just illustrates that by reheating and reusing the oil, we create these PAHs and reactive oxygen species, which are able to damage our protein, our DNA, and our lipids, and overall cause cell injury, mutations, and the formation of cancers. Another thing that was noticed is repeatedly heating vegetable oils have been shown to elevate blood pressure. This is a significant risk factor of cardiovascular diseases, as well as kidney diseases and diabetes, as was mentioned previously. The increase in blood pressure was associated with increased vascular reactivity and a reduction in the amount of nitric oxide that was produced by the blood vessels. This indicates that chronic consumption of the reheated vegetable oils leads to disturbance in the endogenous vascular regulatory substances, such as nitric oxide. Additionally, the oxidative stress induced by reheating can lead to inflammation in the cardiovascular system. Heated oils increase the formation of trans fats and the oxidative byproducts, both of which can contribute to cardiovascular diseases. Trans fat raises your low-density lipoproteins, or LDLs. This is what we commonly call your bad cholesterol. And it lowers your HDLs, what is known as our good cholesterol. This increases the risk of having atherosclerotic plaques forming, which can lead to heart disease and stroke. So over here, we can see a normal artery that is patent. The lumen is clear, allowing blood to flow. And to the right, we can see an atherosclerotic artery covered in plaque. When you have an increase in your LDLs, your bad cholesterol, they get lodged into the lumen of those arteries. You have cells in your bodies which detect this and would engulf them. And oxidation of this bad cholesterol is what actually forms the plaque. So these plaques, if they're on your coronary arteries or any arteries supplying your heart, they can prevent blood flow, leading to something like a heart attack. If one of these plaques were to move, become dislodged, they can go to your brain and cause a stroke. Here I've included some of the results from my survey. So from the information I gathered, 40% of the responders stated that they do reuse vegetable oil weekly or more. 30% of the people said that they reuse it occasionally, and 10% stated they never reuse vegetable oil. The top reasons for reusing it is one, cultural or family practices. I mean, I saw my grandmother doing it, my mother did it, and now I do it. The next big reason was to reduce waste, and the last one being to save money. When asked about health awareness, 64% of the survey participants believed that reheating the oil did affect the food's nutrition. 70% of them said that they would change their habits if the health risks were clear. Some of the big areas for concern was how high the prevalence of oil reuse was, despite some of the known risks. Also, how cultural and economic influences dominate behavior. Another thing was the limited awareness of food safe practices or regulations, and the potential health consequences, including exposure to toxins. The big public health takeaways from the survey was that oil reuse is common, but it's definitely risky, that cultural and financial motivations do dominate, the public is open and receptive to education, and there are opportunities which exist for policy change and some outreach interventions. So here I have some ways that we can prevent the toxic effects. And of course, the number one reason or the number one way to do so, avoid reusing oil. This is the single best way to prevent toxic effects of reheating oil. Once it's used for cooking, it should be discarded or stored properly for single-use purposes. If reuse is necessary, it is important to filter out food particles and store the oil in a cool, dark place. The food safety guidelines generally recommend limiting reuse to 2 to 3 times, especially for deep frying. It should then be discarded. Another suggestion is using proper cooking temperatures. You can monitor the temperature during cooking to avoid overheating the oil. Overheating or burning it can actually accelerate the formation of toxic compounds. And use of oil with a high smoke point for high heat cooking methods like frying. Another good way to prevent toxic effects is to use oils with high stability. So some oils are more resistant to oxidation and degradation. For example, olive oil and avocado oil are considered more stable. They have a higher level of monounsaturated fats and oxidants, which help to prevent the formation of harmful compounds during heating. Another way that we can prevent the toxic effects is to try to use methods of cooking that require less oil. So alternatively, you can steam, bake, grill, and the last thing that I found was actually using an air fryer, which is becoming more popular, which can give you almost the same effect without having to use excess vegetable oil. So I have a few methods for cleaning vegetable oil. A lot of the research is exploring using materials such as clay, silica, and cellulose to filter out the impurities. These methods do improve the color, the density, and the viscosity, but they do not remove the harmful degradation products. Another one that you can use, and it's used commonly in commercial cooking, is magnesol. It's a synthetic magnesium powder that is used to filter impurities from cooking oil in deep fryers. It absorbs the dissolved impurities that affect the taste and smell of the food, which allows the fried foods to be crispier and tastier. This is FDA approved, however, it still does not eliminate the carcinogenic and cardiovascular risk associated with reusing and reheating vegetable oil. There is a study that was published in the Journal of Food Science and Technology, which demonstrated that you can use sugarcane bagasse ash to absorb free fatty acids and polar compounds from used frying sunflower oil. So the sugarcane bagasse is essentially what is left after you make the sugarcane juice, almost a straw. It's burnt until you get the ashes. The research found that by adding 3% sugarcane bagasse to the oil, it significantly reduced the acidity and improved the oil's quality, even outperforming the synthetic absorbents that I mentioned before, the magnesol. Again, while it can improve the quality and it is superior to magnesol, it still does not remove all of the harmful degradation products. For small-scale applications like home cooking, it has been suggested to use a fine mesh cloth or cheesecloth to remove larger particles. Some articles suggest using coffee filter. However, for significant purification, incorporating either the sugarcane bagasse ash or the magnesol may be the only way to really enhance oil's quality. After purification, though, store the oil in a clean, airtight container to prevent contamination and degradation. In conclusion, repeatedly heating or reusing vegetable oil poses serious health risks, particularly to cancer and cardiovascular health, due to toxic compounds that form during the process. Preventative measures, such as avoiding the reuse of oil, using oils with high stability, and cooking at the correct temperatures can help mitigate these risks. Healthier oils like olive oil, avocado oil, and coconut oil offer safer alternatives for cooking. The survey conducted underscores a need for stronger health education and policy guidance regarding reused cooking oil. Cultural and economic factors drive behavior, but the willingness to adapt, if better informed, presents a valuable opportunity for public health initiatives. This concludes my presentation.
Dr. Frederick, thank you for your detailed presentation.
The Grenada Food and Nutrition Council, GFNC, has relocated to Archibald Avenue, St. George's. If you're interested in one-on-one nutritional counseling, please contact us at 473-440-2126. The initial consultation is $50, and follow-up sessions are $20 each. Each visit includes up to 60 minutes of personalized nutrition guidance. To make an appointment, call 440-2126.
I'd like to acknowledge the planners for this evening's webinar. That would be Mrs. Shameen Henry Edwards. She is our Program Development and Research Officer, and also Sharice Bristol. Ms. Bristol is our Nutrition, Education, and Promotion Coordinator. I also would like to acknowledge other colleagues of mine that are here. My boss, our Chief Executive Officer, Mrs. Lydia Brown, who is here. And we also have with us Ms. Gardenia Savory, who is our Surveillance Officer. I will ask Ms. Mark, do you have any final closing remarks, any key takeaways? Because you shared some alarming statistics as it relates to chronic non-communicable diseases in Grenada. Any final closing remarks?
I would say that prevention is key. And so it's important for us to do a lot of self-monitoring and to utilize the services that are provided in our public facilities in an effort to ensure that we are not being plagued. And so early detection really does save lives. So that would be my final takeaway.
Dr. Frederick, I have the same question for you. Your research was really mind-blowing. Any closing remarks, especially based on your findings?
I think the most important thing that even I learned for myself is that I do need to decrease the amount of time that I reuse vegetable oils. I mean, the benefits far outweigh the risks. Even though it may save me a couple dollars or pennies, it's not worth getting something as severe as cancers or cardiovascular disease. I know it's a big adjustment, especially for all of us who have seen it being done over and over. We grew up seeing it being done, we grew up doing it, but it's something that we can all slowly make changes to and adjust. I also think that there was a good question about the regulation of restaurants. I know that there is a National Food Safety Advisory Board in Grenada, and as of 2015, there is a Food Safety Act. So they do routine checks, but how much they check specifically on the reuse of vegetable oil, I'm not sure, but it's something that they can definitely target and put more emphasis on.
Mrs. Brown is present. Mrs. Brown?
A pleasure to see so many people seeing the significance of the topic presented here today. I think we thought at the council that this was a very important topic. We are very much appreciative of Dr. Ariel Frederick, for the wonderful work and the in-depth research that was done on this particular topic. We thought it was important enough that we share this information with the public. It has been a long-standing topic and area that we have pledged to research, and she came in a really timely fashion that we were able to get that done. I do hope that we would have listened to the epidemiological information specific to Grenada. We see a lot of data that's for the region, but looking at the data for Grenada, we see that we have some issues. Now, we can't say that reusing oil is the cause of all our cancers, but cancer has been on the #1 cause of death in Grenada for many, many years. And so we're realizing now that we know that a lot of our men eat out, especially if they're single. And we don't know that consuming foods from reused oils are not impacting them. We see the rates of prostate cancer. Breast cancer is on the rise, the mutation of the gene that results in breast cancer. So all these things we need to keep into consideration. When these webinars go out, it's not just for a one-time impact. We hope that people would share the information. And when the Food and Nutrition Council, we try to put out as much information as possible. And we're hoping that you, the public, I saw the highest number here tonight was 83. I don't know if maybe Ms. Douglas might be able to correct me on that, but I saw 83. And I'm hoping that if 83 of you would share this information to all of your contacts, especially if you know they did not come on the webinar tonight, we would be in a much better place for it. Thank you all, and continue to look out for the information being put out by the Grenada Food and Nutrition Council. We are here for the people of Grenada, Carriacou, and Epidemiologist. Thank you.
Thank you very much, Mrs. Brown. Mrs. Brown is the Chief Executive Officer for the Grenada Food and Nutrition Council. Wanting to give acknowledgement to my other colleague, Mr. Keyshawn Williams. He is a nutritionist responsible for St. John and St. Mark. So on behalf of the Grenada Food and Nutrition Council, we thank you very much for joining us for this very important discussion about the use of reused oil. And with this, you're armed with information that could save the life of your customers, the people in your home, and yourself. Do have a very good evening.
Fried foods are tasty, but did you know that repeatedly heating cooking oil can be dangerous? When oil is heated again and again without being changed, harmful chemicals called polycyclic aromatic hydrocarbons, PAH, build up. These compounds can cause serious health problems, including lung, breast, and prostate cancers. Simply adding fresh oil to old oil doesn't fix the problem, it increases the risks. To protect your health, always use fresh cooking oil and avoid eating large amounts of fried food cooked in old oil or reused oil. A message from the Grenada Food and Nutrition Council. Eat local, strengthen food and nutrition security in Grenada.